stock monitoring was actually one of the first use cases implemented in the CHT, but having said that, we recognize that there isn't a lot of documentation on it, and it hasn't received a lot of attention or features in the past few years. So we plan on focusing some design and development efforts on that this quarter to help improve it. So, but to do that, we really need to talk to community members and users like yourselves. So it was cool to see that 66% of you all are doing some work in stock monitoring. So yeah, we'd love to work with you to kind of better understand your experience, needs, and challenges with stock monitoring. So I'm actually just going to drop my email here in the chat. Definitely reach out if if you'd be willing to talk to us more about your stock monitoring workflows, so we can focus some efforts on making it even better. Really, just one other thing I wanted to mention is that we're super excited to announce that the training card features that we've been working on and is now available as a feature release. So we've shared some details about the training cards in previous roundup calls. So I'm not going to go into detail today, but as a quick reminder that the training cards are there to help you train users remotely from within the app, and the cards can be used for refresher trainings or to teach users about things like changes to forms, and of course, also for changes to CHT core. And with this feature, we really expect that projects will be able to update their apps more frequently and stay more up to date when CHT versions, since in-person training isn't going to be necessary in most scenarios. So just kind of wanted to kind of share a little bit of an update around that. And we're also actively looking for community members to partner with to implement this feature and help iterate on it to make it even better. So definitely please reach out if you'd like to learn more, or if you're interested in implementing this. Again, you can just ping me over email that I shared here.
Many of you know, Medic has been designing, testing, and developing updates to the interface and experience design of the CHT recently. And today I just wanted to cover the larger context to explain why we're doing it, how we're doing it, and what to expect in the coming months. So we're doing this to support the improved learnability for new and existing users by aligning ourselves more closely with Android UX and material design patterns, as you can see pictured on this slide, that are familiar with most app users. And these alignments will also improve the CHT scalability by ensuring that we're a mobile-first framework and that we have room to support more functionality and use cases down the line. So here's an example of one of the updated CHT designs that we've tested that aligns with the examples on the previous slide of material design patterns. And many of you have seen this before. It's on the forum, so I won't go into too much detail on this right now. But as you can see, the larger changes include the action button at the bottom of the left-hand side and the side navigation on the image on the right. So these designs have tested well. But in order to get to this state, there are a few things that we need to address first. So to support the larger improvements, there will be a need for preliminary and incremental updates to smaller features, such as the filter bar search, decoupling positive and negative actions in the bottom action bar before we're able to implement those nav and action button changes previously mentioned. So on this screen, you can see a potential or an example of the potential progression that we might be considering. It might not look exactly like this because we do plan on testing each iteration along the way. But as you can see, the first image, that's our updated filter bar that we need to address, because on the current filter, there are several drop downs in a line, and we just need to reduce items on the interface and able to get to our end state. So that's our first step that we're currently working on that we shared last month. We might be working on search next. On the third, we would be decoupling things like edit user functionality or delete user functionality somewhere else outside the bar. So on the fourth image, we can see the bar is able to turn into the action button. And lastly, we'll be able to change the navigation once those things are sorted. So it's a long plan. It's not going to all happen at the same time. And I just wanted to share what the plan is for those progressions. We are going to test along the way, like I mentioned, and post our learnings on the forum and tweak things as needed. And we encourage the community, as always, to participate by giving feedback or testing with us directly. And lastly, we are aware of the challenges partners are facing with training users on design updates. So just another plug for the cards that Michael was talking about. With each UI update, we will be providing default training card content that's completely configurable. So that should help support with each of these updates to be rolled out remotely. And that's it for me.
And I just have a quick update for the Allies team, which is that we had presented with the bulk upload feature, which allows you to manage users in a bulk capacity in a spreadsheet and then easily upload them into the CHT, bypassing the need to use the command line. This has tested well in the deployments that have expressed interest and deployed it in production. So we are planning on releasing it in version 3.16. We'll touch briefly on 3.16 a little bit later, but our focus otherwise for Allies has been preparing 3.16 for release, which involves, of course, extensive acceptance testing for each feature, and then release testing for the whole release. If you're interested in testing the bulk upload feature still, like Michael said, it has its own feature release to have parity with the care team's feature releases. And if you have any questions about the feature release for bulk upload, feel free to reach out. My contact information is right there.
I'll be taking you through pageant and together with my colleague, Tatiana. So before we jump into what pageant is and how it works, how it helps us implement the CHT, as you may or may not know, CHT is an offline first app application. Meaning that the way we implement that is for all our offline users, which are mostly DHT, CHW, or CHWs, we download a bunch of documents that they need to work offline without accessing the server all the time. And this type of setup yields a problem whereby CHWs obviously have a lot of documents on their devices. This can lead in low performance and low disk space. And given that most of our VSTs normally have low basic specification devices, this really affects the performance of the device. So to solve for that, CHT has a feature that we call paging. So basically, we try to increase the performance and the available space of the user's device by removing the unneeded documents, which are mostly reports and messages, from their device. So by removing this unneeded, I mean they could be documents they don't need to use, like a CHW swab. They won't need an assessment they submitted 3 years ago, 2 years ago, something like that. Yeah, so this is a feature that was introduced in the CHT version 3.7.0. Yeah, so we always get a question about paging. When someone hears paging and how it removes documents from the user's device, it always gets scared that this is deleting records that could be used for analysis and impact metrics. But that's not the case. Paging just removes documents from the user's device. These documents, which are the reports, they remain in the server where they can be accessed by an online user, and we can run analysis on it. It's not that when paging the user's device, it's gone forever. Yeah. So just to let you know that there was an earlier version which was more prototype of paging that was in 3.3.30. So this type of paging is not recommended, and if anyone is using it, we would encourage them to switch to one that was introduced in 3.7, mainly because this type of paging happens on the client side and the client device, if I could put it like that. So what that means is that this deletion of unneeded documents, or the burden was put on the user's device. And just like I've mentioned, or just like you may know, these are really basic specification forms. They have like 2 GB RAM. So it was a heavy burden on the devices and very disruptive to the users. So what was introduced in 3.7 was moving all this paging activity onto the server. We put the burden on the server. And this is basically all the deletion happens on the server side, and what we send, we just send a little messages of what documents to clean up, or what documents to send to the user if it's there. That's very fast synchronization with the server. So as of 3.14, paging has been modified a bit to ignore contacts that have more than 20,000 documents. This is mainly because if you've implemented paging and you still have contacts with 20,000 documents, then it might imply that your paging rules maybe are not good, and they need to be rectified or something, as we shall see in the next slide how this might come up. There was also a feature introduced to log errors that may arise during paging, in the paging process. So all these are logged somewhere in the database.
I'm going to talk briefly about the paging rules from a design perspective, or basically this is what you must have before you start or while you are thinking about paging. The definition for paging here, paging rules is, or while you're being told to create paging rules, you're basically being told to define the type of documents that you want to be removed or paged. You're supposed also to say the time frame within which those documents lie, as well as when that paging rules, when the paging action should run. That's very technical. So to be able to create the paging rules, first thing you must have is you must have an excellent understanding of the service design protocols. The service delivery protocol, sorry, I'm a service designer, so that one flows very easily for me. What I mean by this is CHT is based on care coordination workflows, which are embedded upon care protocols that have been defined by WHO, that have been proved by research and have been tried over and over again. And what happens is a particular action, for example, identifying a pregnant woman, would actually, by a community health worker, would lead that person to be referred to the health facility for antenatal care follow-up by the facility nurses or facility health workers. And then it will need a follow-up to find out whether there is any other action that the community health workers can do to support the woman, maybe nutritional advice, just to make sure that the woman takes drugs for iron supplements, has taken the malaria treatment and stuff. So basically the CHT, as we all know here, is based on care coordination. You must be able to know those care protocols so that you know that you're not paging a document that is being relied upon for a care task that is going to be triggered. So the other thing that you need to know when you're creating the paging rules is you can no longer rely on a document that you have paged for application logic. I mean, if we all get out of here with just one thing, I think that's the most important thing that you should have. When you've paged a document, you'll not be able to use the information from that document offline, or basically within the phone or the tablet that is working offline to trigger a task or to update a target, a current target, or to even update the current user profiles or contact summaries. So I wanted to give you an example of paging rules that we've come up with, and what I'm going to wear the design hat while we're creating these. Paging rules are based on the programmatic component, or basically how the service delivery protocols look like. And one of the things that we've realized is you should be able to work very closely with the subject matter experts, and in this case we'll find is the program people. Sorry, I went off. Is the program officers or the experts on malaria, the experts on reproductive health care, the experts in stock monitoring, or whatever subject area. These are the people that you must work very closely with. And programs are different, delivered differently. So you'll find an ICCM program is in this area is being executed differently from a program, from an ICCM program in another area. So you need to have the context in those both areas, so that you create paging rules that are context friendly. So I'm going to give the first example is of a pregnancy workflow, where the instructions, assuming they're coming from a service designer, are page all the pregnancy follow-ups reports, which are older than 1 year from the date of their reporting. This one shows the document that you're paging, which is pregnancy follow-ups reports, and tells you the time frame. Here is a year. When I'm giving this instruction, I am aware that this program will not need to use any information in the program's follow-ups within that year to trigger any other schedule. For example, it will not use information from the pregnancy follow-ups in these reports to trigger a family planning task. We know for most family planning, it happens 6 weeks, is initiated usually within 6 weeks of delivery. So if you feel like your program, or if you designed your program in such a way that within, it's possible that information from the pregnancy follow-up is going to affect family planning, then you need to be careful on the time frame that you provide. Another example that I've given here is for patient assessment workflows. The first one is purge all assessment forms that are older than 3 months old since time of reporting. That one is versus another program where it says purge all assessment reports that are more than 2 months old. Since its date of submission, I did not trigger a referral follow-up or treatment follow-up. So you realize that the first one is very general. So it doesn't matter whether there was a referral follow-up or there was a treatment follow-up. And that's probably how the programming there looks like. However, for the second one, I put up a possibility. You may realize that in this program, the implementers may want to create tasks for follow-on of patients who have who are truly sick. I mean, the assessment showed that they needed to be referred, they needed to be treated, and they've had like 3 consecutive assessments within those 2 months. So if you purge this data, the subsequent follow-ups that were supposed to be for high risk or vulnerable clients are not going to work as they should. They're not going to be revealed or triggered. And therefore, in summary, what I'm saying is, while you're creating the paging rules, make sure you know the content of the workflows, and make sure that you work very closely with the subject matter experts. And of course, say what document your paging is going to be done on, and give the accurate time frame based on the information from there.
Here we basically have a user who has a lot of documents and a lot of unneeded documents, like we discussed. Things they submitted 2 years ago, 3 years ago, they might not need to do their work today. Yeah, as you can see, it's trying, what the app is trying to do here now is tracing 7,000, almost 7,000 documents. These are a lot of documents, especially for a VHT. On average, you'll expect them to have about maybe 2,000. So this is where paging comes in. This is how it helps us. So basically, this is what the app looks like before paging. We have our tasks, our contacts, and all that. And in our about section, we have access to the doc count, the number of documents that this user has. Which you can see is 6925. Yeah, so this next section is probably is after. Now, after we push the paging, we configure the paging and push it into as an update to the end users, the offline users. They receive an update dialog. They can update. So when this user opens their app, it will run through this cleaning process. So what this cleaning process is removing all these unneeded documents and keeping the app light so it can be usable and not so disruptive, not so slow for the DHTs. Yeah, so this runs for a couple of minutes, and just to know if this video has been sped up, so it's not in real time. It might actually take longer because you have a lot of documents. So this is why paging is really necessary for these kind of scenarios. Yeah, so after this, you can see now it has done the cleaning. All the unnecessary documents have been cleaned up, and the upload. It still functions as normal if the paging has been, the rules have been implemented correctly, like Kasani was talking about. As you can see, we have our tasks, the cortex are still there. To go back to about section, you can see we went from 70,000 dogs to 4,000, which is really an improvement. Yeah, and it depends from user to user. Some user, like this particular user, has a lot of contacts that you can see. Yeah, thank you.
2016 is coming up, and the main thing it's going to offer is the bulk user upload and translatable admin UI, and the ability to more easily upgrade to future releases. There'll be more on GitHub.